realized that these days, every 10 years, you have a new generation.
Yes, ma'am.
So even you will be a generation older to the ones who are now working,
Yes,
who are
ma'am.
the ones who are JR.
Yes,
Society has changed, the world has changed, technology has changed,
yes, ma'am.
availability of technology, deeper pockets, a lot of things have changed. Let's make the change for the better. And the best way to is to build bridges between the past and the future and let there be a continuity.
Yes, ma'am.
So if I get a from the admin, where are you? Vamsi, please tell me when we actually start.
Ma'am, we start in 3 minutes.
Okay, we start in 3 minutes. So what I see, most of them are our residents today, isn't it? We have at
Yes.
present 23 participants. Most of them are our residents, JRs and SRs.
Yes.
But since it is their problem, they wanted to know about all this. So be it.
Yes, ma'am.
What else? Where's Aruni? Aruni, unmute
Ma'am, I'm
yourself.
available.
I can see
Yeah,
your
are you able
moods.
to hear me?
Hi, Teja.
Just a second.
Hi, ma'am.
Hi. So
Yeah,
you're
I
back
hope I'm-
you're back in the country or you're still away?
Yeah, I came 3-4 days ago, ma'am.
And you have a
I just
job
came.
now? Or you are
No.
just being a father?
Just
You
being
have
a
a lot
father.
of you
Yeah.
have a lot of catching up to do on that front.
yeah, I'm doing that now.
Ah.
It's an enjoyable time now.
Yes,
I
till
plan to take a break.
till the child becomes tired of you and says, "Ab jao, kaam pe jao." Teja, Teja,
Yes, ma'am.
I talked about that mycology thing,
Oh,
and
okay.
and they generally had twice a year they would have the training of doctors from other institutes, but because
Okay.
of the pandemic, it's not going on.
Oh, okay,
So,
okay.
if you wanted urgently, immediately come through like short-term training kind of thing,
Okay.
it has to come through the dean.
Yeah, she has already
And-
applied
huh.
through online portal to the dean. She's awaiting the reply.
I think it's in the website only.
Yeah.
Yeah, the dean will then send it to the department. The department will say yes,
Okay.
and according to, and even this can be a short term, but there will be even in future. I mean, one day
Okay.
the pandemic will be over, and
Mhm.
these training sessions will restart. They can,
Okay.
and it's some kind of about a week-long program. So
Oh, okay.
those things can be done.
Yeah. Thank you.
Indralil has put video on.
Ma'am, it's 6 o'clock.
It's 6 o'clock. So Vamsi tells me it's 6 o'clock. So today we are going to address certain questions which were posed by our current junior residents when I was trying to impress upon them how proud we are of our past. They have their own questions and own insecurities. And instead of giving them one of my moral lectures, I thought it would be a better idea to have the younger people who've had first-hand information of what life outside PGI actually is. Because I'm an awfully inbred person. I joined this institute as a JR and have not left as yet, except for the few months that I didn't have a job. Other than that, I haven't gone anywhere outside Chandigarh. So I won't be the ideal person to address these queries. So that is why we've taken some, what I tried to do is select people from different decades. who have been residents in different decades. This is the one common factor. The other common factor are they are excellent radiation oncologists. They have all excelled in their own lives. They have been all over the country and abroad. They have excelled as radiation oncologists, and they are doing extremely well, even for the youngest one, which is Arun Ilangovan. So now I will ask Dr. Sophia to take over because she's going to be the moderator of the panel. And over to you, Sophia.
Thank you, ma'am. Thank you. And thank you for the opportunity. Good evening, everyone. I welcome my dear professors, juniors, and colleagues for the meet today. We have 4 panelists today. Dr. Sanjeev Sharma, sir, who belongs to 1988 batch of PGI, who is currently working in Manipal, Bangalore now. And we have Professor Anushil Munsi, sir, who belongs to 2000 batch of PGI, currently working in Manipal, New Delhi. And Dr. Indranin Malik, sir, who belongs to 2006 batch of PGI, and he's currently working in TMC, Kolkata. And finally, Dr. Arun, my junior, who belongs to 2016 batch, and who is just back from Canada after completing his fellowship. So I welcome all the 4 panelists to the meet today. And today's meet is all about what are the challenges faced by the youngsters in India, of the radiation oncologists in India, once they are out of the PGI Institute, not only PGI, and all the institutes, all the radiation oncologists, what are they facing once they are out for getting the degree, and what are the academic opportunities they have both inside India and outside India. And also we are going to address the interpersonal differences we face in the professional in our institutes. So to start with, I invite Sanjeev Sharma, sir, to begin with, to give a short introduction of what inspired him to join this profession and how was his period through the residency and post-residency. Sanjeev, sir, we welcome you.
Yes. Yeah. So, can everybody hear me clearly?
Yep.
Yes, sir.
Okay. So, good evening all. And let me begin the innings. Thanks, Sushmita, for giving me this opportunity. So, I will go strictly by the syllabus given by Sophia. So, in the interest of time. So, the first question is, what inspired me to do radiation? So, I think I would give the credit for that to someone ex-PGI gentleman called Dr. Rajiv Seem, with whom I happened to work in Shimla. And I was planning to do surgery. And I went into radiotherapy department, basically because there were no night duties and there was plenty of time to study. By the time I finished those 6 months, I could realize that, what you could achieve in oncology or in radiotherapy by sheer, good concepts and lots of knowledge. By the end of those 6 months, I lost interest in surgery and did only radiotherapy. When I applied for PGI, I didn't apply for surgery. I applied for only radiotherapy, although I got surgery in Shimla. But I didn't join it, and my father, for a long time, did not pardon me for that. So I think that's what inspired me. How was my residency? Great. We had a great gang. Sushmita was part of that. We had great teachers, and Dr. Sharma, Firoza, Dr. Ayagiri, and of course, Dr. Gupta, Dr. Negi. So we had very good teaching environment, very good professional environment, very good personal environment. We were good friends outside. We still today are. And in fact, our friendships have grown closer. So I think residency was a cakewalk. It was very, very good. Okay, so post-residency. So as Sushmita said, you move out of the secure environment of PGI and the life hits you. So when I came out, which was in, I passed out in December 87. So that time.
Okay, sorry for the mistake.
It doesn't matter. It doesn't matter. It's one and same thing. It is just a matter of one digit. So it doesn't matter. So in those days, there were hardly any private opportunities. So I'm talking of 1988 or perhaps say early 90s. So the primary options were restricted to government jobs. But again, at that time, radiotherapy was not that much expanded. So there were not that many facilities. So facilities were limited. Opportunities were further limited by various factors, like, reservation of the classical nature or what you call as internal breeding. So so if you leave your own institution and go out, you face what is called as internal bleeding, and that posed lots of difficulties. Private jobs at that time were very, very limited. It's not like today. Bangalore was one place at that time which had 3 private centers. Other than that, I remember only Batra Hospital in Delhi. That's all. I don't think there were any private opportunities. I tried my best somehow to find a government job. I couldn't. Finally, at one stage, out of desperation, I went into private. So that was a scenario at that time. So uh, it was difficult environment. So there always are stalwarts. There always are big fish wherever you go. So I think what helped me sustain and what helped me grow was whatever knowledge I had gained of brachytherapy. And so one thing I would like to stress to the youngsters who might go out in the future, that during my period, all these years, although I'm a practicing doctor, I have tried to maintain my focus on enhancing my skills. I think that's going to be very important. Once you pass out, howsoever good institution you may join, if you don't enhance your skills, you will get outdated very fast. And nowadays you get outdated even faster. So when you like to enhance your skills, one is to improve your core competence. Like my core competence at that time was brachytherapy. So I try to improve upon that. And you, of course, need to diversify also. So you can't say I'm good only at brachytherapy. So as part of that, I did various fellowships. I think I did 6 UICC fellowships to enhance my knowledge about IMRT, IGRT, radiosurgery, etc., etc. So that's what I did, and I think that would be one of my take-home messages for the present-day youngsters. Now, coming to what are the opportunities presently for the present-day people. Plenty of opportunities, no dearth of opportunities, but people are also more. So I think ratio remains more or less same. So so you have lots of opportunities, lots of centers available for more number of people. But you also have a new challenge now, which was not there in my time, and that is what is called as a corporatization of the health services. Doctors, when I joined, doctor was important. Patient would wait for me for 3 days, 4 days, 5 days, if I am not available to come and see me because they felt he's a good doctor. That era is gone. So now doctor has lost importance. It is the corporate structure which attracts patients. They don't care how skilled you are. So you need to keep that in mind. And whenever you go out, you always need to remember that. There are plenty of examples where this is happening. So now, what are the difficulties which I noticed? I never had to do postgraduate training, but post graduation people have been coming to me, and I have trained quite a lot of them. So what is the issue? The issues I see, one of them is training levels. So training levels, whatever exists now, cause difficulties for the people to work in the cutthroat competitive world which is there outside. So when I say training level, it doesn't necessarily mean that training per se is poor. It doesn't necessarily apply to PGI, because what I say applies to I have derived from my exposure to people from many other places. So one important thing I would like to mention: our curriculum needs to change now. It needs to become more broad-based, and taking into account many of the Western residency programs, I think we need to incorporate 6 months, 1 year, or some kind of exposure to internal medicine. And in most of our training programs, our residents are not rotated in other departments in the hospital. As a result, they don't develop interpersonal skills. As an extension of that, I would say multidisciplinary interaction. Majority of the people whom I have interacted with, when they come out of their training in those institutions, they never had any multidisciplinary interaction. So later on, they don't have the confidence or the courage, or they don't feel it is important to do that. So I think we need to inculcate that. And so when you come out, the competition is cutthroat, whether it's academic institution, where it may be for the post or for publications, or in private sector, it is for patients. But the unfortunate reality is, yes, there is a competition. We are all, but it's not a healthy competition. We don't look at it like a tennis game between, say, Nadal and Federer. We make it like a war between Israel and Palestine. This is what is happening. We are constantly trying to pull each other down. We are always, so if you want to take a stand, or I want to take an academic stand that this treatment is not required, the referring doctor or a surgeon doesn't bother, because he knows somebody else is available who will do it. So we are all, undermining each other, and that's what is causing difficulties for people. When the decisions are taken, we don't count, and this is one of the reasons. When I look at my colleagues, my neurosurgery colleagues, they work like a team, or even if they don't work like a team, they don't talk bad about each other. Same thing is about my medical oncology colleague, and I'm sure they have differences, but they sort it out in a closed environment. Outside, nobody knows about it. This is a big ill which is plaguing our community. And of course, last but not the least, it is high time we cut short. If we cannot completely eliminate, we need to cut down on hierarchy a bit. This hierarchy is coming in the way. And as a result of hierarchy, the youngsters find it difficult, to come up, to discuss, and to, I think, and to raise questions. And unless we overcome this hierarchy, I would say the intellectual growth of people will remain stunted. And when they will go out in the world outside, they will face difficulties. So I think this much I had to say as an introduction, and rest we will take as and when the questions come. Thank you.
Thank you, sir. Thank you. Thanks a lot. And that's a great input which you have given, especially the peripheral postings, which we lack during the specialty time. I believe that definitely if we inculcate during the post-graduation period will help a lot to the future generation in handling cases. Thank you, sir. Thank you a lot. And now I invite Professor Anshil Munsi, sir, to take on the mic for the next.
Sophia, thank you. Am I audible?
Yes.
Okay, because I didn't hear her voice for the second half. So thank you, Dr. Sushmita, for having invited me and considering me eligible for this elite panel that you have selected today. So I understand I have to go through the same points as have been taken by Dr. Sanjeev. So the inspiration part. So initially when after MBBS, I had this itch that I had to go out of Jammu somewhere to a big institution. And the big institution in my minds were like PGI, AIMS, Tata Memorial. So I took this entrance for PGI. I didn't know what radiation oncology is at that time. So when I reached whatever they have a ranking system and this thing, and so there were 2 or 3 disciplines or 4 disciplines at that time. I selected radiation oncology. It appeared a good this thing. I said it's oncology, so it appears fascinating. So let me take this let me see for a month or so. So after 1 month, I was so impressed by you all the faculty and the environment and the setup at PGI that I couldn't just move out of that place. So we had a very eminent faculty there, and the legacy of that department was so overwhelming and it was so impressive. Dr. Sharma was there, Madam Patel, Dr. Sushmita, Dr. D.P. Singh, and of course the legacy of Dr. B.D. Gupta. And then we had a very able resident team also, and the senior resident team was led by Dr. Sushil. I don't know.
Sushil.
So he immediately took me under his wings and brainwashed me completely. So he was a very tough guy, but I held him in high awe at that time and still do even today. So it was a very, very wonderful journey at PGI. And among many things, we learned the importance of punctuality, how to multitask, how to, I don't know, discipline of all kinds and this thing, but it was fun at the same time as well. So it was a very beautiful and a wonderful journey, those 3 years that we spent at PGI. And then after spending 3 years, I had the feeling that for senior residency, why shouldn't I try some other institute? Why shouldn't I try to have a flavor of some other place? So the name of Tata Memorial Hospital was going around in my mind for some time. And so I landed at TMH. I thought, let me do some senior residency there. So I did senior residency for an year at Tata Memorial Hospital. Dr. Dinshaw was there. And the important thing that I realized on joining there, that they had this concept of site specialization there. So that was a new thing for me. And some other things, you know, every institute has its own ethos, flavor, and something that you can take. I'm not saying that everything is good in every institute, but there are many things that can be learned and understood and adapted and taken home from big places like these. And then again, after a year, I said, okay, why not now try another big institute? So I went to AIIMS and I finished rest of my senior residency at AIIMS. Again, a big name and this thing, and a different kind of a work culture. Again, many things to learn, understand this thing, high flow, number of patients, this, that. So all of these big institutes I had covered by the time I had finished my senior residency. AIIMS, Tata Memorial Hospital, PGI Chandigarh. So the big three had been covered by that time. And then I got the opportunity of a faculty position at Tata Memorial Hospital. So I went back there, spent around 7 years in Tata Memorial Hospital. Again, I was in the breast, brain, lung sites there. And these sites I have still continued to hold close to my heart even now. It appears a bit odd to people today when I refuse invitations for talks on prostate cancer and genitourinary cancer and GI cancers, but then that is the way it is. I have most of my publications in breast, lung, brain, and I do most of the talks in. So I feel that the way forward, although not immediately now, but the way forward should definitely be some form of site specialization, some interest, at least if you can't wholly and solely dedicate yourself to 1 or 2 sites, at least have an extra interest in 2 or 3 sites. Because as I see things today, I don't think it's possible for anyone to have information and knowledge, whatever evidence in this thing for all the sites. I think it's a challenge. Some super brilliant guy could only do it. I feel you could manage 2 or maximum 3 sites, and I think it's very important to keep some kind of focus and some kind of interest in 2 or 3 sites. So that is a bit of a message for the postgraduates, the newcomers. And then what are the other challenges that they would face when they would now come out and they are fresh? So what I feel is that challenges have existed in every phase, in every time period. Present day challenges could be a bit different. What we experience could have been a bit different, but challenges have always been there. And I think you have to stand up to the challenges. As Dr. Sanjeev was saying, that we have to keep on continuously honing our skills, continuously continuously trying to learn and be at the cutting edge of whatever evidence is there and whatever technology is there. Now, the other issue, and I also agree here with Dr. Sanjeev, is that somehow I do feel that machines have kind of taken a bit of more precedence than doctors, or the name of doctors, or the skill of doctors. And I see it more and more commonly in the environment that I'm working in. With, for example, after TMH, after leaving TMH, I came to Delhi, I joined Fortis Gurgaon, and now I'm in Manipal Hospital, Dwarka. So this kind of, for example, most of the patients who land up, they have some kind of this thing in their mind. They have Googled some machines or this thing that, of course, they do your background check as well. Many of the patients have actually come to you after reading your CV, after seeing where all you have worked, which is quite good, but they also have in their mind the machine and this thing, which I feel is actually more than what is required, because I personally believe that most of the modern day machines actually do the same job. So this kind of thing that is in their mind, that this particular machine is going to do something magic for you, I don't know how it's being propagated, and perhaps some of us are culprits for that. So anyway, that is what my perception is. And is there any other issue left which I have not discussed? Yeah, I was thinking about the challenges that postgraduates would be facing, I think, and we have done some bit of audit also. I'll tell you about that also very quickly. So there could be challenges in terms of, for example, family. For example, ladies could face issues in maternity leave, this, that. There could be issues related to mentorship. There could be issues related to the pandemic that we had very recently, COVID, and how their teaching was affected in the pandemic. Whether they were able to sustain that amount of training in the past 1.5 years or no, and how has that affected their skill set. That would also be an interesting study to look at. What are their apprehensions when they come out? So can there be gender bias presently in the community? And we actually did our publication would come out very soon, that we have found that in our survey, we found that more than 50 to 60% of the women radiation oncologists feel that they have been subject to some kind of a bias. And that's very important, this finding that we have come out with. And after this topic was given, I actually sat down and I thought that why shouldn't I come out with kind of a small paper to help our postgraduates. So very soon, I hope we'll publish a small article as to how radiation oncologists should approach the job scenario. What are the opportunities for them in India, in abroad? What are the options in government sector, in the private sector? What are the pros, cons? What is the SWOT analysis? What are the strengths, weaknesses, opportunities, and threats for each kind of approach that they could take? So hopefully that publication should be out very soon. And yeah, this is my final message. Keep on publishing, keep on reading, and keep on writing. So that is very, very important. And that message I learned from PGI, and I've never left hold of that message. So that message is very critical, very crucial. And when I interview some newcomers to my department and ask them, how many publications do you have? It's really very sad to hear the numbers of this thing. Most of them would say that it's in press, and most of them would say it's in some non-index journal. And that's very, very sad. So my message would be keep on writing, keep on putting your publications in good index journal. Thank you.
Thank you, sir. Thank you very much. And I think that will serve a great information for all the junior residents. And the take-home messages from sir is you should choose your site specialty and proceed and do more research on your site specialty among or the field, and you should publish more papers. And one more valid point was, sir said there is a bias between the gender bias faced by people, but from PGI, if the study had been conducted in PGI, then I don't think it would stand up, because
I didn't say there is a bias. I said women feel there is a bias.
Feel they bias, but maybe...
You don't know the whole story, Sophia. We haven't opened up as yet.
That's a Pandora box, and I don't dare open it now. So we will get deviated, ma'am. So moving on to the next panelist, and I invite Professor Indranil Malik, sir, to take on the mic for enlightening us and take through the residency and your post-residency period, sir. And over to you, sir.
Thank you, Sophia. And I'm very grateful to Dr. Sushmita for inviting me. I am very, I was thinking about what inspired me to be a radiation oncologist, and the answer is nothing. I had no idea about radiation oncology. I struggled to get good ranks after finishing my MBBS because I never thought about preparing for PG entrance. And after getting a 2000 rank in PGI one December and then a 500 rank in PGI the next December, I was really desperate to get in. And when I did get a rank, I was very happy. I had a choice between ENT, gynae, and radiation oncology. I knew I didn't want to be a gynecologist. I thought ENT was very boring. And so amongst the clinical subjects, so I thought radiation oncology sounded very mysterious and interesting because I knew nothing about it. So that's how I chose radiation oncology. I was very happy also because the other important point in my mind was that I wanted to propose to my girlfriend. So I was very happy to get in. So once I got in, it was a completely different environment. I had no idea that radiation oncology was such an interesting field. And I was guided a lot by, the teachers. I learned a lot from every one of them. We were very, very scared of them also. And I'm pretty sure that, many of you will feel the same way when you come from a place far away or you come from a protected area and you join a big institution. We were scared of them, but we learned a lot from them. And because it was a strict department and we didn't realize it at that point, it inculcated in us certain basic principles, the principles of punctuality. I think Dr. Anushil already pointed that out. The principles of discipline, of doing your job correctly, of being meticulous. And these are things that are not there in the syllabus, but these are things that are very, very important. And when the other thing that I distinctly really value about PGI was the camaraderie and the friendship amongst the students. So I have vivid memories of being helped by my seniors and the senior residents like Dr. Bhavna, Dr. Manishi. I distinctly remember the help I received from the other PG students who were with me. I had 3 very, very friendly seniors in Amar, Siddharth, and Dr. Buddhi. I had a very jovial, happy-go-lucky senior in Dr. Shweta, and we all had a great time. We were all getting scolded, but we were all having a great time. So that's how it was. And during that time, I think that because of the PGI was, I think, going through a bit of a change. I think that it was realizing, and Dr. Sushmita can tell me whether my hunch is correct or not, from setting up a very, very good academic MD program, because really, I don't think that at that point, I don't know about all the MD programs now, but at that point, the emphasis on teaching that we had over there was unparalleled. I don't think any other MD program had such focused and such, meticulous teaching. But it was also transitioning into, it was realizing that it was important to publish. And we were all very excited at that point. We were trying to, get out our files. We were trying to, write papers. And Dr. Bhavna, took me under her wings, and she was doing a project. She was writing an analysis for the HDR brachytherapy. And it is in doing those things, doing those projects, that I learned things that, it doesn't matter what you learn in, your MD syllabus. It is about how to solve a problem. We had to write a paper. What do you need to do about it? Okay, so we got together. We pirated SPSS. We bought a book. We actually stole a book. I went to the Sector 11 Xerox shop, and there was a book on SPSS, and we didn't know how to use SPSS. So I basically told the guy, I don't know who it is for, but I want to take this. I'll give you as much money as you want. And I took it, and we came back and we all studied it together, and we learned how to analyze and things like that. So these are things that I will always very cherish about my time at PGI. Now, at the end of my MD training, I had planned to actually go to the UK. And I had, told my teachers there that I will not be continuing there, and I'll be going to the UK. But when I came out of PGI and I reached Kolkata, there was something that happened, and I couldn't go. So what I did was that I joined as a faculty member in another trust charitable hospital in Kolkata. That was one of the only radiotherapy centers of the 2 private non-governmental radiotherapy centers. This was called Thakurpukur, and I was a faculty member there. I was a consultant, and I soon realized that I was completely unprepared to be a consultant for 2 reasons. One is that in 3 years of MD, you do not pick up all the skills that you need to deal with patients and to take decisions about them. The second thing was that I realized that my colleagues there did not have requisite training. They had kind of struggled through their careers and they were working in a place and they couldn't teach me anything. So I realized that I had a lot more to learn. And 6 months into that job, I realized that I had to quit. And I went for senior residency to TMH. In TMH, of course, there was a completely different scenario. And I'm really grateful to some of the teachers there, including Dr. Munshi, for helping me settle down there. And of course, to all the students there who helped settle down all the people who were coming from outside the TMH, training program, because we were outsiders. And it helped that Dr. Jalali and Dr. Munshi were from PGI, so they gave me a bit of leeway. And it was, an adjustment that later, I really, when living in Mumbai teaches you to be really smart. And more than any of the training that I received in radiotherapy, I learned a lot about survival in Mumbai. Survival, from the fact that, in PGI, I was a good student. Everybody thought that, okay, we have to live up to Indranil standards. But in TMH, I realized that everybody knew more than me. So you have to suddenly go and you're out of your comfort zone. Everybody's better than you. All the consultants are practically your age. There were many people who were kind of my age and they were already consultants. Everybody had 20, 30 publications as junior consultants, and you're like there in trying to swim. And it helped me to learn how to survive. I also learned a lot from the resilience and the hard work, the long hours, the train rides and everything. And again, at the end of 2 years, I kind of felt that I had more or less learned what TMH had to teach me. At that point, there was a job opening in Kolkata at Tata and they were going to start. They had just planned to start, and Dr. Dinshaw, got a few of us together and said, "Hey, you are not applying. We are going to open a job in Kolkata in Tata Medical Center." And we applied, and there was an interview, and we got selected. And then we realized that that hospital was going to take a long time still. And there was some of my seniors or friends really had gone to Princess Margaret for fellowship. And they kept telling me, you should come, you should come, you should apply. And I applied there, and with their help, actually, I didn't get in the first time, but with their help, I got a fellowship offer from there. And in Princess Margaret, again, you learn a lot, and it's completely different environment. I'm sure many of the people here have been there as well as fellows. And I did a fellowship in head and neck radiation oncology. And I also pitched in and volunteered to do some GI. So I had a little bit of an idea how things worked. And then by the time the hospital in Kolkata was ready, I came back and joined. Now, the other thing that I think is important for young radiation oncologists to know is that probably you learn the most in the first few years of your independent consultant position. So when we were setting up Tata Medical Center's radiotherapy department, again, I had great colleagues, and we would sit down and we would go through all the protocols. We would be very meticulous and work together. And the first cases that I got, I had no idea how to treat them because they were all complex cases, half treated, this and that. And you learn in the first few years of your consultant position. I'm very lucky in my institution because, I've never had to worry about survival. I've never had to worry about how many cases I had. And that has helped me, inculcate, different aspects. I've been able to pursue my interests. And I think a lot of it has been said by Dr. Sharma and Dr. Munshi. I think what I would say has been a defining, experience in my, my progression in my career is that I've never really planned anything too much in advance. I've let things happen, and I've never hesitated to get out of my comfort zone. If somebody wants help in something that I don't know anything about, I usually go try to help them. And I learn much more in the process than if I try to, plan my life, decide that I will not do this, I will not do that, that will be beneficial for me, that will not be beneficial for me. So I think that it's important and to be very organic in your career path. I think radiation oncology is a fantastic profession. There are very few professions which have so much integration of evidence, of technology. If you're interested in technology, it's a absolutely perfect profession. And following up on the cue of what Dr. Sharma and Dr. Munshi said about corporatization and importance of machines more than people, I feel that we have been guilty as radiation oncologists of letting this happen. I think that it's important for us to speak to our patients and be their friends. I think communication, the first few minutes that you spend with your patient, is very important. It's important that you have, good communication skills so that you can actually give the patient the impression that you are there to help them. And afterwards, it doesn't really matter if you don't have the fanciest machines, the proton therapy, this and that. I think that it's this, communication that helps. Another thing that I wanted to mention was that I learned after I became a consultant, the importance of clinical oncology. Although we did clinical oncology in PGI when we were training, we left that. I left that thing and I went to, TMH and then to Princess Margaret, and where we were only doing radiation oncology. And when I came back, and my colleague Sanjay, who had come back from the UK, insisted that, we should stick to clinical oncology. It's important. Initially, I was very hesitant, but then I adopted it, and I feel that it's been a really, really important decision. And because you look after a bigger period of a patient's time, it gives you much more exposure to situations. And I would encourage that if you can keep clinical oncology as a part of your career path, I think that will be a great choice. So thank you so far. And later on, I'd like to tell you a bit about, training opportunities, etc., when the time comes. Thank you.
Thank you, sir. Thanks a lot. And I think the juniors should take an important point of moving out of your comfort zone in your workplace. It is more lacking. And as sir said, the machines can never replace the words of comfort from the doctor. So spend time with the patients in gaining their confidence. And then I'll move on. Thank you, sir. And we'll move on to the next speaker, Dr. Arun, who is my junior. And I welcome him to India because he is just back from Canada, completing his fellowship. And we both are from same state and same district. And when he chose this field in counseling, and he came to the department and met me, and first question he posed was, "Ma'am, what is the scope of this radiation oncology for me in future?" This was, I still remember him approaching me and posing this was the very first question he posed to me in Tamil. And from that day on till now, I don't know whether he got answer for that. What is the scope of this field here? And he will enlighten us over that. Over to Arun.
Thank you, ma'am. Thank you. Thank you, ma'am, for inviting me to be a part of the panel here among the all the experts who already come out in the field and have established themselves to be great radiation oncologists all across India and also abroad. Coming to the questions that you have set up for me, the first question about what inspired me to become a radiation oncologist. The first inspiration for me to become a radiation oncologist came from my rotational internships. And during that time, I met with a doctor by name Karthik, and he was the radiation oncologist here in Coimbatore Medical College. And it was only a few, like a few days, one week of a clinical rotation. And I found himself to be a calm, polite, and compassionate person towards the patients. And the environment itself, like within the radiation oncology, seemed very comfortable. That was one of the soft pointers like that inclined me towards choosing the profession. But the next thing that happened was obviously meeting with ma'am. I did not know what radiation oncology actually meant, like how the machines are utilized, how the treatment planning is being done. And it's a very complicated field. It would take at least 3 to 6 month period to understand what really happens within the oncology. But I know it involves some part in association with radiology. So I was fascinated by looking at CT scans and using X-rays and those kind of things. And I know this would happen when I came to ma'am. So when I met with Sophia ma'am, she took me to the simulators. Like just by the simulators, we had uh, uh, the Sushmita ma'am's room as well. So as I went by, I knew that this is where the department is, and these are the components of the department at least. And having a look at the simulators and the contouring systems alone, that made me feel like, yeah, I could fit in here. Probably it's something where it's a field where I'll be able to look into these CT images and things like that. And now, having completed the radiation oncology profession, looking back, I now realize that it's a wonderful field. In fact, it would have been nice if, as undergraduates, like in the medical school itself, if we had a more elaborate exposure to the radiation oncology. And the reason why I say this is we do not get to understand what really happens in the undergraduate period. In fact, the oncology itself is a myth. At the time, we learn a little bit about cervical cancer, not much about other cancers, and we do not know how radiation works or how it interacts, apart from the MCQs that we need to require to clear through the examinations. So I now realize that it's a very dynamic field. We involve almost all walks of oncology, like we integrate with all other systemic therapies and the now immunotherapies, and the hemato-oncologists have their role to play. And when all other departments do their job, from a radiation oncology perspective, we have a role in every subspecialty of oncology. So that's where the integration becomes really important. And we are able to integrate using, again, the instrument-based, system-based, and machine-based, and even software-based. Now the artificial intelligence is also gaining its role. So it's becoming very dynamic, and we have got various areas within which we could specialize, and we could diversify our interests, and we'll be able to choose which area we could like to work on. And again, we also have the opportunity to work both as physicians, clinicians, and as also as surgeons. Not major surgeries, but we are also able to do brachytherapy and explore more on that perspective as well, which is more satisfying. No other field will give you like this kind of a dynamicity, I would say, where you would have the option to explore the various aspects of oncology as a whole. And next, as after getting into the residency, it was a really enjoyable period. That's what I would say. And the team as a whole was superlative at that time. Even my colleagues, I was lucky to be one among a batch of 5. So we had the support all the time. And even my seniors, including Sophia ma'am, Teja sir, Deepak sir, even the senior residents, Dr. Tapesh, Dr. Nikesh, and I might have left out a few names, but they're all great people. We used to join together. And even after every seminar, every planning meet, we used to have a very good time. And in fact, that's where the informal learning part comes in. It's not that we always used to crack jokes or just make fun out of things. We also had the informal learning going on and the informal teaching coming up. And you remember more of this than actually the formal teaching and the academic lectures. But it doesn't mean that the academic lectures aren't helpful. To be frank, we have got the best academic department here, even from the basics, like from the radio biology and from system-based lectures. It's been extensive. That's what I would say. And ultimately, over the course of residency and towards the completion of my residency, I was able to feel that I become more competent and confident in recommending a treatment to the patient. But just like Dr. Indranil said, we might not be able to understand each and every scenario. Every patient will be different, and we will need to have inputs from our seniors, colleagues, and everyone, and we'll be able to discuss, and we'll have to enhance our skills to be able to handle these patients. And it's a learning process. It just doesn't stop there. Within that 3-year period, we will have to move on during the senior residency, and also during the post-residency period. I was able to understand a lot more. And when I say that, I would divide that into clinical skills as well as research skills. I wasn't involved in much research skills other than the thesis during my undergraduate part, but only during the postgraduate part, post-graduation senior residency part, I was able to work with, during the different clinical rotations, I was able to work with different staff and then be able to work on a research project. And that is where the communication skills come in. Like we'll have to collegially integrate with the department, find out the interests of the mentor, and then work with them, and then ultimately be able to publish a paper. So to do that, we need support. We cannot do that as an individual. We'll be working with them, find out what is needed, and then work on that, and then be able to publish. And coming to the questions that we have from a perspective of opportunities that might come up after finishing your residency. So the opportunities that you need to look at will basically be determined by what you would like to achieve in your career as a radiation oncologist. Like it's in a way looking back in the reverse direction, like finding out what you would like to do. So either you could be a clinician, like in a private practitioner, or you could be a researcher, like a researcher. I mean like a researcher and an educator. And the third thing would be lab scientist or integrating to become a translational oncologist. So the third part is gaining more role in the recent years, particularly with more and more realization of the role of immunotherapy, molecular therapy, and also the combination therapies. But most often people would choose to become a clinician or a private practitioner and or an academician with an educational component attached to it. So what would make you determine what you need to choose? It's your personal interest. You will have to write it down. It's a few set of questions which you could write down. You could think of what made you choose this profession and what is motivating in this profession. And once you go through the clinical rotations, once you go through the subsites, you will be able to understand what interests you more, either head and neck oncology, GI oncology, or what type of radiation that we practice, either the newer treatments like the SBRT or the brachytherapy side of things. So it's important to understand what interests you. And once you understand these interests, you can actually work yourself to develop your skills in these specific areas. And that's where even simple things like maintaining your logbook will help you determine how much you have captured or how much you have assimilated during the course of your residency program. And then it sets a goal for you. You revisit things every year or at least every 2 years to understand how far you have succeeded in achieving your goal, how far you have satisfied your personal interests, and then you will be able to change your direction. When I say change your direction, it's about working more on what you need, or if that doesn't satisfy you, you will always have the option to move to a different area. So when I say that, it's only during the residency you will have the liberty. And after the residency, just like Dr. Indranil said, you will have to select your area or the specialty. You'll have to limit yourself to either 2 or 3 sites of work so that you will be able to do more and more on less and less. And that's where you will be able to become a complete practitioner, establishing yourself in that particular domain. And the important thing about setting these goals is you'll have to understand how you are achieving it. You need to have realistic goals. You'll have to be simple and practical about what goals you have set, and you'll have to understand whether you will be able to achieve them in the given time. So when I say that, if you think brachytherapy is your area of interest during the course of residency, you could look at how many brachytherapy procedures have you assisted and how far have you come up in the 6 months time or in a year's time. And then moving on to the next year, you could also look at like intracavity brachytherapy procedures are relatively simple for residents to be performed. You could also find out how well you are able to do them independently, not just in the skill side of things, not just in the OR, but also after the OR in the planning, because that's the most critical part where you will integrate all the basic knowledge of radiation oncology and then be gaining competence or the confidence ultimately to perform the procedure by yourself. And you ascertain or evaluate yourselves in specific periods of time and make sure that by the end of the residency, you have achieved your goal. And not, this is just a simple example. You could also look at that in the same way as a researcher, and you could think you want to publish one paper or a couple of papers in a year, or the next year you would work on and publish more papers, like 3 papers, and the next year you could think about 4 more papers. So you'll be able to add more quantitatively as well as qualitatively, because once you work and once you gain the knowledge, you will be able to understand how to do it the next time. So these are just realistic examples, and you could have your own set of goals, your own set of interests about what you would like to do. And when I say advanced treatment techniques like particle therapy and other things and translational research, it's a bit complicated at this time. That's where you will have to move out, look for an area or look for an institution which has that kind of an expertise. And you got a lot of information available in the internet. You could look at specific universities. You could look for a researcher who is doing it. And if you want to connect with them, there are multiple modalities at this time. You could send them out an email or send them a message directly in profiles like LinkedIn, and you could connect with them, let them know that this is the area where you would like to work. And you will seek the guidance from the mentors here to help you out to reach out to them. So this is how you connect with people so that you will be able to achieve your personal interests. And even there is one another thing, like if your long-term goal is to practice in a specific area, when I say an area, like in a locality within or in and around your town, or if you want to move out, sometimes you will also have to determine your goals based on that as well. Because if you are going to practice in an area which might not have that kind of a setup, or you might not be able to get into that kind of a setup, and you want to establish it, you can gain the idea. If you think you don't want to establish it, you need just the skill set to implement it, then you could work on how to integrate these different options and then implement them into your practice. And the most important thing during the course of residency itself, I would say, is to remove your fear out of your mind. I had this fear always, like this is something that I've carried through my school days as well. And I used to hesitate a lot before interacting with the seniors. But ultimately, I realized that getting scolded is not a sin. You learn more. You do not want to do mistakes, but if you do mistakes, be strong enough to face them, strong enough to accept them. And the most important thing is you will have to work on your mistakes and change them. And that's how you learn. That's the most important part. And the second thing is you will have to determine your interests. Once you're like while you're going through the rotations, determine which area interests you and try to work on that area. Try to connect with the mentor who is working on that area and they'll be able to help you out both clinically as well as academically if you want to publish any research work. And the third thing is about the interpersonal relations. I would think, I assume that it's more of a personality trait rather than trying to build things. But, personality matures only in the third to fourth decade. So you have the time, you can change yourselves, you can work on it, and you can build the communication, because radiation oncology as a department is not an independent department. You'll have to connect with medical oncology, surgical oncology, and all other walks of oncology, and even pediatric oncology. You have multidisciplinary rounds. And once you connect with the different kinds of people, you understand where you stand and what you need to do from a radiation oncology perspective. And the fourth and the most important thing is, do not compare yourselves with other specialties. So if money making is your priority, there are different ways of making money. Ultimately, that wouldn't satisfy you. Depending on your priorities, you will have to, and your interests, you will have to determine which area you would like to work. If you compare the different specialties, I know a lot many other specialists, even my own colleagues who have done their super specialty in other departments or in other wards, and they could be again, like there is a problem with oversaturation, where people are not able to find their jobs or not able to get into their desired area, the location where they would like to practice. And that is where you will have to be open. You'll have to be flexible in terms of where you would like to work, because ultimately wherever you move out, it's a new experience, be it private or in the public sector. That's what my speakers have been telling you in the last half an hour or so. So wherever you go, it's all a new experience. Everything, starting from academics and starting from the way the department is set up, even the administrative side of things, it is all totally new, very different. Understand why it is different, understand why they are different, and realize why we were doing things the way we did. And you have your own judgment, like make your own judgment from their opinions as well as our own evidences, and then implement them into practice. And ultimately, the patient is your king. You will have to communicate and satisfy the patient, and be satisfied with yourself in what you are doing, and comfortable in what treatment you recommend to a given patient. I hope this gives some information to you. And yeah, I'll be ready to take questions whenever they come up.
Thank you, Arun. That's a lot of information for the junior residents and the future generation to take from you. And I think they will learn from their learn from their mistakes and adapt to the place wherever you are. That is the point to be taken from here. And to moving on to the questions, I think there are only 3 questions posted by the audience for the panelists. Apart from that, I have 1 or 2 questions for them too. So to begin with, the first question, I'll pose the question for Sanjeev Sharma, sir. Sir, there's a question from the audience. They have asked, what do the panelists recommend for integrating radiotherapy in the cancer care pathway, given the challenges at present? Sanjeev, sir?
Some of it, yeah. Can you hear me?
Yes, sir. Over to you.
Yeah. So I think some of it I have already covered. That I feel that integration is lacking, partly because during our training time, I think our training needs to be more broad-based. So like Dr. Indra said, that kind of little more broader exposure during training we need to give to our people. And so basically we need to enhance our training levels. We need to enhance our skills in interacting with other specialties. Right now we function like islands, and generating referral or managing patients is an evolving process. So we should not be sitting in our department and saying that if a patient is referred, then we will treat. If treatments are changing or they are evolving, we have a evolving role in a particular indication. We need to engage with them and discuss with them and then take it forward. So that at this point of time is lacking. And in that particular matter, as of now, I see medical oncologists are doing very well. And part of the reason is their broad-based training and the way they interact with others. So I think these things, and they may not, if we, the best time to provide this training or provide this background is during residency. That's a very good foundation. And then of course, then subsequently it's up to the people to take it forward. So I think I would say that from my side, that would be the suggestion. That I think we need to incorporate. You see, many of the training many of the residency programs abroad, first year people spend in non-radiotherapy subjects. So I think that's something very good. Our syllabus, what we are following, or this was structured decades back. It perhaps is not okay for the present day practice. So I think that would be my take on this question.
Thank you, sir. Thank you, sir.
Sophia, can I butt in for a minute?
Yes, sir. Yes,
I just
sir.
wanted to
Please.
know, do the participants, I think that we are giving our message and everything, but do the participants want to know a bit more about the training opportunities available after, concretely as to how they should approach their training, whether they should go abroad? Because we haven't really touched on that very systematically. So do you believe that we should discuss that a bit more?
Yes, sir. Yes, sir. We should, sir. Actually, it was one among the questions
Some
per
of the
se.
questions later also can be related to this.
Yeah,
Yes,
can I just talk about
Please,
that
sir.
for 5 minutes from my perspective?
Please.
I think that
Please go ahead, sir.
Yeah, so I think that when a person passes out of an MD radiation oncology training, you definitely need to realize that you have what is the world outside. So the world outside is very competitive. Why? Because the MD training seats are now, there are many MD training seats, MD, DNB. The job scenario in the well-equipped setting is increasing, but it is not keeping pace with the number of people coming out of the training programs. So you are going to face tough competition ahead. So how do you deal with that? I believe that how you train yourself right after your MD is very important, because in a competitive job market, if you try to join a consultant position too early, you are going to get superseded later on. So you need to spend 3-4 years, even 5 years training after and you should try to get training in different institutions and always try to get a stint abroad. The reason is that you get a different perspective. Indian medicine is getting more and more westernized, and the inputs are all coming from outside. So if you get a choice, even if you ask your teachers, if you ask Dr. Shushmita, she had gone to the UK. So that training, it may not teach you anything more than what you've learned in India, but how the system works, how the loopholes are filled, how people work together without getting conscious about their mistakes is something. Those are the skills that you really learn. And you also get to learn how the supporting departments, medical physics, therapists, when you go abroad, one of the first things I learned was that the therapist is not some lowly creature they often know much more than you, and they are your colleagues. And it's very important to build up that your own department when you come back and work in India. I'm hoping everybody will come back and work in India. And when you do, you are going to be able to support your technologists, try to build them up. The second thing is that you have to, in order to do good training, I think that what are the options open to you? So if you really want to train, you have to train in a busy department. Okay, you should not make the mistake right after your MD of going to a less busy department. You have to go to a busy department because patients teach you things every day, right? So every new patient that you see, every contour that you do is important. Once you're going to the busy department, and how will you then manage your goals of applying to a foreign fellowship program or anything? You have to choose which departments you go to. When we were setting up our fellowship program in Tata Medical Center, I think that the thing was that what are we going to give our fellows when they pass out? Because we are not an MD program. We are not a program that is attached to a university. So we spent a lot of time trying to build relationships with our colleagues in the UK and in Canada, and we tried to make a pathway for them. So we focused on clinical oncology. We made sure that our training program was integrated with the RCR clinical oncology program. And we made sure that our pathway for these fellows led to the UK. So about 80% of the fellows who join our fellowship program have a straight path to the UK. They can go to Leeds, they can go to Cardiff. This pathway is important because all you need to do is just work hard in a fellowship program, and you will be taken down that path. You will be taken down a structured training program in clinical oncology. You will go down that path to a training position in the UK. A couple of our fellows are in Princess Margaret. So you have to have that bit of long-term vision. That you say that, okay, this is my goal. I want to be a radiation oncologist, or I want to be a clinical oncologist. If I want to be a radiation oncologist, then these are the busy hospitals that I should train in. I should then apply for this. If you want to apply, two things are important: publications and references. And I specifically butted in to talk about these things because they're very important. So publication, you have to start publishing early. Publications do matter in a competitive world, especially for training positions in good places. The second is references. Now, I would like to point out that, when I applied to the Princess Margaret Fellowship, I didn't know all these things. I approached Dr. Sushmita and I approached Dr. Munshi, and I'm again pointing it out because we are in this meeting. And both of them wrote nice reference letters for me. Without those reference letters, which was pointed out later to me by Professor Catton in Princess Margaret, is that when people apply from India, they shouldn't get reference letters just from the senior most person in the department. Like this person worked in this department from this date to this date, and no specific details about you. You need to work with people so that they can give you good reference letters. They can tell you which projects you worked with them. There has to be content in those reference letters, and to build that content, you have to work. You have to actually work with that person. You have to actually help that person achieve something for them to give you that reference letter. So if you do that, and if you have some publications, it's relatively not very difficult to get into an MTI program in the UK or into a fellowship program in Canada. And once you're there, you need to make provisions that what do you need to learn so that you can come back. And these are things that are very, very important. Your training is not done once you finished your MD. You're a senior residency, and aimless senior residency isn't going to work. Your senior residency has to lead to something. And I've learned it. I did not consciously learn it. I learned it by following the seniors before me, which everybody does. And at every step, each senior that I helped in something helped me back twice as much by providing me pathways, by giving me mentorship and guidance to do what I wanted to do in life. Yeah, that's what I wanted to say.
Can I add a small note?
Please do. Please do.
Yeah, so there is one question here about interpersonal relationships with juniors and seniors. And I think that is also a very, very important issue, because half of what you actually are is your skill set, and half of it, I feel, is what is your approach towards your colleagues, your juniors and your seniors. It doesn't help only that if you are a very brilliant academician and you are very poor in all the other things. So you need to keep a very critical balance between these two in your daily working in your life. Whether you are a JR, whether you are a SR, whether you are a consultant, or whether you are the head of the department, I think this applies equally to each position in your life. So I think please maintain very nice relationship and be a good team person, because otherwise you'll be wasting a lot of time in things that are not relevant to your career, and that will actually be detrimental to your career of no fruit at all. And you'll be wasting a lot of time in these things. So stay away from all these controversies, keep focus on your career and your life, and you'll achieve all success. And I agree with Indranil that the competition is going to be tough. I was doing a quick kind of an estimate. We have around 521 radiation oncology centers. We have around 760 odd machines as of now. The problem is that we were growing in machine numbers at a rate of around 7 to 10% before COVID, and that has dropped down now to around 3 to 4% per year. However, the PG output is continuing at the same pace. We're churning out PGs at the same pace. Nothing has happened to that. And we have actually around 560 MD seats in India. I'm not sure how many get filled. Plus we have DNBs. So I don't know how many, but this is the big number that we have that is getting added to the existing radiation oncology thing. And with the dropping of the new installations and the new machines and the dropping in the growth rate, I think competition is going to be quite tough. So please hone your skills, please be at the cutting edge and have that extra zeal in you. Don't just stick to whatever work has been given to you or this thing. Go beyond that 2 steps, and then that is the key to success in life. Thank you.
Thank you, Dr. Munshi. I think Dr. Sophia is cut out because of, she has a power cut because of some thunderstorm. So I take over from here. Another question is to all the panelists. Should we look to develop our skills in specific radiotherapy techniques, or look to develop a holistic view of clinical oncology? This is from our students here. Any one of you can take the lead and answer.
May I go ahead now?
Yes, Arun.
I would say that it is more of a personal choice. It's like after MBBS, we chose to do radiation oncology. And again, within radiation oncology, we are subspecializing. So they have the opportunity to look into the subspecialty where they would like to work. And if they are going to work in a specific area and then probably incorporate those into their clinical practice as a long-term prospect, then as long as they have the interest towards that area, they'll be able to establish it. And be it clinical oncology or the type of radiation therapy technique, I don't think there would be a big difference as a whole.
Thank you. There's another question. What is the perception of radiation oncologists among patients in the private sector? This is asked to the radiation oncologists. How do your patients, particularly people who are working in the private sector, how do your patients perceive you? This is a question from Abhradeep Datta.
So Sushmita, I will answer that.
Yes, please.
So perception varies. It actually varies from people to people, and it varies from institute to institute.
Yes.
So so if in the private practice, I would say if we, for some of the reasons which I mentioned earlier, as compared to our other colleagues, I think it's on the lower side. That's a harsh fact. So that's the reality. It's on the lower side. Is that adequate? Is that enough, or I need to elaborate?
I'm sure if anybody else who works in the private sector has any other opinion or something else to add.
I think it has been a mixed kind of an experience.
Yeah, that's what I mentioned. That's what I said.
Exactly.
It's
Exactly.
All kinds of patients.
It takes all kinds to make a world.
Yes, yes.
Just like the
Ranging
radiation
from-
oncologist is not the one uniform. There are radiation oncologists, and then there are radiation oncologists. Dr. Tejinder, I know you are in this audience. What about your experience in the private sector? I saw Dr. Tejinder around.
I think she left.
She left. Okay. And I can also see my senior and
she
my
left about
teacher, Dr. Dipinder Singh, DP. We all call him DP. And he's our DP. And I can't resist asking him this question. How difficult was it to establish yourself in US after working here as a faculty and you were associate professor when you left? How difficult was it? In a nutshell, you'll have another opportunity another day when most of you will, you, Sandhu, all of you will do the main talking. But just a nutshell today.
Yes, I was associate professor at PGI when I decided to move. And I would say I'm very proud to be one of the PGItes, and the training I received at PGI it made everything so easy for me going through all the stuff in USA and establish myself. So hats off to PGI. Thanks to PGI. Absolutely amazing training I had. And I want to say, you know, I really owe to all my teachers, but one of my best teacher was Dr. Vivek Kaushal. Oh my God. Today,
yes.
Incidentally, I have to say that I was remembering Vivek today, 8 o'clock morning. I'm at work doing my radionuclide safety annual course. And the question came, what is stochastic
MPD,
and non-stochastic? And
we
I
had the
immediately thought about Vivek Kaushal taught me that in 1984.
Exactly.
Definition
of MPD.
Yeah, I owe a lot to PGI. I owe a lot to my teachers. I owe a lot to my best friend, Vivek, who actually brought me to radiation oncology. I was doing ophthalmology in my medical college, and he taught me something like a retinoblastoma, and it's a long story, but he's the one who got me into radiation oncology. I'm really proud that PGI training nobody can match in the world. Not nowhere, not even USA, nowhere in India. So thanks to PGI.
My friend Kunal used to say that someone who has done junior residency in PGI, you throw him at the other corner of the world, they will come back home. This is what the training here is all about. And I think the people, at least my generation and the generation immediately after that, was trained to do that. These days, the younger ones may think that I'm being too harsh and too cruel. But honestly speaking, children, it's to make stronger persons out of you and strong radiation oncologists. I think we wind up today. And since we are going to make this a monthly feature, we have already decided about the next topic. Only the speakers need to be decided. It will be about how to start a new radiation oncology facility. We'll rope in the people with maximum experience. And so till then, good evening, good night. Have a wonderful Navratri, and we'll meet after Diwali. Okay, so good night. Thank you all.
Thank you. Thank you,
Munshi. Thank you, Sushmita.
Bye-bye.
I wish I could also see. Hi, Sanjeev.
Bye, DP. Hello, how are you?
Incidentally, today we had a seminar on the same topic, acute and late reactions of whole body radiation.
Yeah, I miss my seminar days
Friday.
and writing on the board.
Friday. Yes. now we do PowerPoint presentation. We have improved a little. Okay, bye-bye. Good night.
Bye. Thank you, guys. Thank you.
Okay.
Yeah.
Long live PGI.
Yes.